All right, why don't we get started? And we may have a few more folks join us as we get going. So, hello again, and welcome. I'm Lee Yates, co-facilitator of the TBC at UBC Network and clinical associate professor in UBC's midwifery program in the Department of Family Practice within the Faculty of Medicine. I'm joined today by my co-facilitator, Ben Fair, who's the Assistant Director, Health Systems at UBC Health. And thank you again for joining us today. Before we begin, I'd like to acknowledge that the UBC Vancouver Point Grey campus is located on the traditional, ancestral, and unceded territory of the Musqueam people. And the UBC Okanagan campus is located on the traditional, ancestral, and unceded territory of the Syilx Okanagan Nation. I'd also like to recognize that UBC's activities take place on Indigenous lands throughout British Columbia and beyond, and that you're joining us today from many places. I acknowledge the caretakers and traditional owners and stewards of these lands. I'm grateful to be joining from Coast Salish territory, specifically on the lands of the Musqueam, Squamish, and Tsleil-Waututh nations. Please feel free to share the lands you're joining on from the chat if you wish.
The TBC at UBC Network is supported by UBC Health, which works under the Office of the Vice President Health to help address complex challenges affecting the health and well-being of individuals, communities, and societies. UBC Health facilitates collaborations across disciplines, faculties, external partners, and communities to improve the ways we train people, develop knowledge, and shape policy to ultimately address inequities and improve the systems that foster and support health. The TBC at UBC Network convenes health professionals and leaders, community members, academics, and policymakers to bring forward questions and ideas that are important for team-based care in BC. The network supports and complements province-wide efforts to enhance team-based care in BC by focusing on education, research, evaluation, and knowledge translation, and by enabling participants to learn from each other and connect with their efforts.
If you've been with us before, you know that we like to start with a couple of Zoom polls to get a sense of who's in the room with us today and who we're sharing with, both for ourselves, but also for all of you as we join in conversation a little bit later. We also like to see what you hope to gain from these sessions. And so I'm looking at Chen waiting. So the first poll asks, what perspective do you bring to the conversation today? And please choose all that apply. We'll take a look at the results together in just a moment. Great. So we've got a lot of health professionals and health administrators, health authority folks with us today. Flanked by some UBC faculty and staff, some students, community members, and researchers. And it looks like learning and knowledge sharing, finding inspiration and motivation, and exploring resources and supports are our kind of key motivators or key goals that are bringing us together. I'm very excited for today's session, which explores joys in work as a foundation for effective and sustainable team-based care. We'll explore the evidence-informed tools and BC-based learnings that can help teams build psychological safety, cohesion, and meaningful engagement in everyday practice. Before beginning, we want to acknowledge the reality that many people are working in right now. Uh, there's burnout, overwhelm, cynicism are commonly highlighted issues in how our healthcare sectors are currently working. And joy in work can be a difficult topic to approach, especially if it feels like adding another goal to a situation that's already at maximum capacity. It's also important that this topic isn't only about individual resilience. Joy in work is shaped by teams, by leadership, and the broader systems people work in every day. We hope today's discussion creates space for an honest conversation about both the interpersonal and structural conditions that help people and teams thrive. Throughout the presentation and throughout the session today, we'll use Zoom and Slido polls to collect reflections. All of the questions are anonymous and help us understand what resonates most and how we can enhance future sessions. For today, our session has three parts. So we're going to begin with a presentation from our speakers, Jessica Barker and Dr. Marianne Morgan. From there, we'll move into breakout rooms on three themes: research, education, and practice innovation. You can choose which breakout room to join based on your interests. And then finally, we'll reconvene as a group, as a large group, just before 1 o'clock to share highlights from each breakout room. And then for folks who are able to stay with us after 1 o'clock, we'll continue the conversation in the larger room and see how we might continue these conversations going forward as well. Okay, that brings me to the edge of the preamble, and I will happily pass over to Dr. Marianne Morgan and Jessica Barker and allow you to introduce yourselves, please.
Thanks for that great introduction. And Chen, if you can share our slides, that'd be great. So, hi everybody, I'm Marianne Morgan, a family physician in the Central Okanagan, and Jessica Barker's here with me. She's a director of primary care with Interior Health. We are gratefully joining from the unceded traditional territories of the Silks First Nations just down the street from UBCO. Our journey started back in 2018 as a physician quality improvement or PQI project focused on addressing compassion fatigue. There should be a first slide back at the beginning. There you go. Perfect. I'm not sure where I got to, but we're focusing on compassion fatigue and burnout within our palliative care team. And then this project grew into a Doctors of BC Scale and Spread project on team well-being. And today we want to share the Team Wellbeing Matrix that we've developed. Next slide. We have nothing to disclose. Next slide. So I want to start with this quote from Don Berwick at the Institute for Health Improvement, which is out of the States and does a lot of work with joy and work. And the quote may seem obvious, but often, as many of you know, in healthcare, we don't look after our teams very well. So I'll just read it out just to emphasize. You cannot give what you do not have. The gifts of hope, confidence, and safety that healthcare should offer patients and families can only come from a workforce that feels hopeful, confident, and safe. Joy in work is an essential resource for the enterprise of healing. Next slide. So we know it's tough when you're working short-staffed with too many patients and to care for, to look up and care for your team. So how do you do that? So for us, joy in work was a big aha moment when we started this work. We were really focusing on the moral injury, the fatigue, the burnout. And this was like, well, why don't you turn that around and look at what you can do? So the iHigh white paper acknowledges that leaders often have trouble figuring out how to create joy and well-being for their teams. And this image shows 4 key steps that leaders can take. The first step is asking what matters to you to individuals. The second is figuring out what gets in the way of workforce well-being in your own teams. The third is to have all levels of your organization or health authority support this work. And the fourth is making small but meaningful changes using a quality improvement approach. And then data and measurement, using those PDSA cycles, can convince your systems folks that this work is work they should champion. Another big aha for us was the quality improvement safety 1, safety 2 approaches put forward by Hofnagel. I don't have a slide on this, but where we often look at where things go wrong and how to prevent errors in healthcare. Safety 2 approaches really look at looking at what goes right and how do we emphasize that. And it really lifts the front lines up as the experts in their knowledge. Next slide. So when we were asked to scale and spread our PQI work, we puzzled a while on how this could be practical and doable for teams, really busy teams that don't have a ton of time. And through literature reviews and an international environmental scan, we identified a gap. There wasn't a tool to help measure and engage teams in improving joy in work and well-being. So we created one. the Team Wellbeing Matrix, along with a guide for leaders. And we're excited to share the matrix with you today. This QR code will take you to the whole guide that the matrix is built around. So I'll just briefly tell you about the guide. It's written as a journey that can help you and your team find your own path. You move from the first section, which is gear up for an adventure, complete with a packing list, can stop in at navigating detours, and on to tracking and reflecting your experiences. There are downloadable, colorful infographics and links to our favorite websites and important references. Next slide. And our big message here today, and Lee, in your introduction, you talked a lot about the existing landscape in BC healthcare. A lot of where we're hoping some of our crises in manpower, person power, is in interdisciplinary teams. And this work is totally about teams. How do we engage all of us, and how can it not just be hierarchical and leader driven? How do we lift up the front lines to lead and engage and co-create? Next slide. So here's our team wellbeing matrix that the guide is built around. And so the matrix is both a measurement and an engagement tool. So it's based on a model that tracks team growth, allows teams to easily find themselves and see their progress. There are 5 pillars. The left pillar shows a team that is unaware or struggling. The middle pillars show teams that are feeling more safe and taking ownership. The right pillar shows a team that everybody wants to work on. And it's okay if teams don't move through the pillars in order. We know that team growth isn't always linear, and it's more like a game of snakes and ladders. Internal factors like staff turnover or external factors like restructuring or budget cuts can really create setbacks. Next slide.
Thanks, Marianne. And now it's over to me. So this is a pillar, and each pillar on the journey map has signposts, we say. So the first signpost is self-awareness. That's how individuals see themselves within a team. The next is team dynamics. So that's how the team functions and feels overall. We've also included the patient's perspective and how they are in these stages, and the team's path in improving quality, because we kind of put forward the team wellbeing matrix as a quality improvement tool that you can use with teams. Next slide. So each pillar has its own page in the guide, and that includes team vibe, which is like a snapshot of what it feels like to work in this team. There's coaching tips, which are simple ways to support and guide the team. We've got change ideas, which are kind of practical, easy to try ideas to build connection and engagement. And the change ideas really come from all over, within our own research, environmental scans, conversations with teams, and Marianne referenced the iHigh's Joy in Work white paper, and insights from other leaders in this space like Helen Bevan and Amar Shah. So today we're going to dive into 3 of the 5 pillars. Then we're going to offer a few ideas from teams who have tried some of this work. So looking at this slide, that's kind of the purple unaware pillar that you see within the matrix. So starts on the far left side and then moves over to the right. In this unaware team, they're really feeling stuck. People seem disconnected or hesitant to step up. And to be successful, team members need to lead or own the work. But in these early pillars, we find it usually takes some leader-driven effort to help get things moving in the right direction. Next slide, please, Chen. So this is a simple but powerful engagement tool that we recommend in our guide for leaders, particularly for teams who are in that kind of unaware, that purple, or explore, that blue phase. And at the end of each shift, for this good day, bad day tool, how it works is at the end of each shift or day, staff rate their day using a simple scale on these paper tickets, as an example. And they can also note what made their day good or what made their day not so good. Why it works is that the insights you get back are incredibly valuable, and it's all about engaging with your team and gaining a really, truly like a deeper understanding of what matters to them. Next slide, please. So this is the no pillar. So at this stage, teams are becoming more engaged, more supportive, and starting to be open to each other's input. Another change idea example, one of our local teams, the palliative team that Marianne and I worked with, made a simple but powerful change at the end of their day check-in. And now they start with what went well today. And then they ask what could have gone better or what could we do differently. So by shifting that focus away from venting, they've built a more constructive and supportive team culture. Next slide, please. So finally, we have the resilient pillar. This is the team that people really want to be a part of. So teams really, at this point, are thriving on trust, shared decision-making, and a sense of ownership over their work. So instead of leaders driving the change, like we're seeing in more the unaware pillar, in the resilient pillar, team members are really taking the lead, whether it's mentoring each other or launching improvement projects. And one great change idea highlighted in our guide that we have learned about is called Schwartz rounds. And Schwartz rounds are really a safe space for teams to come together, share their experiences, and support each other through the emotional challenges of their work. Next slide, please.
Okay, so here's the whole matrix again. Let's move. So Jess just told you about how you might engage teams and individuals. Let's show you how you might use this for data and measurement. So next slide. So there's 3 different levels of measurement to keep track of when you're doing this kind of QI stuff. So the individual level captures personal perspectives. And then so like that good day, bad day stuff. At a team level, our team matrix really starts to shine. And so if you've engaged and you're starting trying to do some PDSA cycles, the team can quite quickly go, oh yeah, we're right here, or no, we're over here, and this made a difference or not made a difference. Systems level data can look at metrics like sick leave, overtime, or patient care surveys. And if you're going to start doing this or you're already doing this, we really encourage folks to track their progress, celebrate your successes, and learn from your failures. And it's okay to make failures. That's the whole idea of making these small tests of change and then checking out to see if it made a difference. And I think it goes to building that psychological safety and trust in teams that we know is so important. And then, yeah, make your data visible to your teams in creative and engaging ways. So this slide is an example of team measure using our Team Wellbeing Matrix. Fraser Health's corporate teams wanted to improve their interdisciplinary relationships. And they worked together for 6 months trying a variety of different things, and they saw some improvements. So the way they did their measurement was they numbered their pillars on the matrix from 1 to 5, and then they used quick electronic surveys to check in at baseline, 2 months, and 6 months. And gray on the left is pre and blue is post. So you can see there's a gradual shift over that 6 months to the right side of the matrix. So easy way for everybody to see where they were at. Next slide.
And this is why it's helpful to pay attention to the systems level measures. These are the results from our initial PQI project that Marianne referenced. And we saw there in that PQI project where we worked with our palliative team over a year, we saw a 50% reduction in sick time over that kind of project year. And that was through really increasing staff engagement and peer support and really asking our team like what matters to them, really listening to that and co-creating these solutions together. And the Fraser Health teams that Marianne just mentioned have also decreased sick time too. And these were really, for us at the beginning, were kind of unintended consequences or like ripple effects of the work that we were doing with our teams. Next slide, Chen. Thanks. So I want to share an example from one of my teams, which is the West Kelowna Urgent and Primary Care Center. For those unfamiliar with urgent and primary care centers or UPCCs, we provide care for urgent health concerns within 24 hours that don't require emergency department resources. And many also offer ongoing longitudinal primary care. So this is team-based, whole person-centered care with nurses, physicians, nurse practitioners, physiotherapists, social workers, and others working together. One of the first things I did when I came into this team was use the Team Wellbeing Matrix to get a quick kind of temperature check of the teams. So I asked the patient care coordinators where they felt our teams were sitting on the matrix, and that gave me an immediate insight into the team's needs, challenges, and how best to engage with them. So using that team wellbeing matrix, it became clear that the West Kelowna UPCC team was primarily in the unaware and explore pillars. So I just want to share how we utilize the good day, bad day tool that I spoke about at the beginning to really start meaningful conversations and engage the team where they were at. Next slide, please. So the good day, bad day tool, we brought that out, and over the course of 1 month, the West Kelowna UPCC team rated their day at the end of each shift. Data was collected weekly and reviewed for trends, and at the end of the month, results were shared back with the team during a large team meeting where we brought everybody together. And here's a sample of what was presented back to them. So overall, the West Kelowna UPCC's team average score over that month was a 7 out of 10. And here is a run chart with all of the data compiled visually. And we can see that many of the scores are above 7, which is really encouraging and shows that a lot of people are having positive days at work. At the same time, there are also a number of scores below 7. And what's interesting is that many of those lower scores fall on the same days, meaning multiple team members were experiencing more challenging days at the same time. Go to the next slide. So I also broke down the comments from the good day, bad day tickets, and I really wanted to see what made it a good day for staff. Go to the next slide. Perfect, thanks. And we put all of those words together in a word cloud, and here's a word cloud of all of the good day comments. So you can see what kind of pops out and comes alive, or words like teamwork, positive, workload. PCPs is primary care providers, so that just speaks to the provider piece. Nice, able, colleagues, family, workload, staff. So lots of great words there that really made a good day for people. We can go to the next slide. And in looking at those themes that we saw in the comments, on the good days that were rated as good, the UPCC team consistently highlighted a few key factors. So days that went best were when we had provider coverage and RN staffing was adequate, and which allows for a smoother patient flow, higher quality of care. Strong teamwork and collaboration also played a big role in positive experiences. And we found when workloads were manageable, patient flow was manageable, and the patient interactions were positive, that staff were more likely to describe their day as a good one. Next slide. So then that brings us to what made it a bad day. So I did the same thing for the bad day comments and made a word cloud. So for context, the UPCCs, like many areas, continue to face staffing challenges, and at our UPCC in West Kelowna, there are times when the clinic operates with limited provider coverage and may be staffed primarily by RNs and allied health professionals. So it's really evident in this word cloud the impact of the lack of providers, and then what that impact then kind of trickles down to in terms of the patient or the client experience too. So you can see some of those keywords are, again, staffing and teamwork, but now we've got rude, mean, grumpy, the words like understaffed, hard day, volumes, short, moral distress. And for the team, it was actually quite hard to see these. I mean, it's what they're experiencing, but when we presented it back to the team, it was hard to kind of look at this word cloud. But in some ways, it was a way of a snapshot of their experience. And when we look at, again, theming out what made it a bad day for people, a few clear themes came up. So staffing shortages and provider coverage gaps were common challenges. So when we're short-staffed, everything feels a bit heavier. Some days we're also impacted by difficult patient interactions or behaviors, and that can really take an emotional toll on our staff and our teams. And finally, safety and security concerns were mentioned. And those moments we find and we hear can really create stress for both staff and patients. And so what did that tell us? So hearing directly from the team has been incredibly valuable. Using this information allowed us to plan meaningful and targeted changes. This is a slide that we presented back to the team. And so I think another valuable piece to this engagement with the Team Wellbeing Matrix and also tools like Good Day, Bad Day is that it's acknowledgement. Staff are being heard and their moral distress is being named and validated. And as a team, we're now working on addressing the issues that are within our control, like workload. Safety and security issues are also being escalated to more senior leadership tables, which has led to real traction and tangible changes to address workplace violence in our urgent and primary care centers. And so with trust building, concerns being acknowledged, and action starting to happen, the team is beginning to move into the next pillars of the matrix. So today we shared our Team Wellbeing Matrix and the accompanying guide for leaders. And our hope is that this can be used with any team in any setting. And in the spirit of collaboration, we encourage you to share this widely. We're always happy to share our work and the workshops we've developed too. We know the biggest impact comes from sharing what we learn. So let us know if you use the Matrix or our guide for leaders. And we know that building team joy and well-being is more powerful when we do it together and not in isolation. Informal networks and community of practices can really support this work we have learned. And we also really hope to publish this work and would love to include any insights from different teams, what's working for you, challenges you've had, and successes you've had as a team. So our contact details are here. Please reach out anytime.
Thank you so much, Jessica and Marianne. Fantastic. So much to dig into there. I'm really looking forward to the conversation coming up here. Before we go into those discussions, we want to take a moment to gather some quick feedback. For the people attending here today, these questions we're going to ask, your responses are anonymous. They're not going to be displayed here, but we want to be able to learn to improve our future sessions. I'm just going to show the screen. And so we'll start with the Zoom poll, and these are based on the presentation. How relevant is it to your work or interests, and how much does it influence your thinking about team-based care? Thank you all. And so moving on, so I just pointed out at the top right there, there's a QR code and a Slido invite. And so we'd really like for you to engage with that as well. We will come back to that later in the session to look at the responses. And the first question there is a word cloud. And we'll review that together during the group discussion. The remaining questions are for feedback. They won't be displayed here. Please feel free to start responding now, and you can keep adding thoughts throughout the session. So now, let's go into our breakout rooms for small group discussion. We have 3 themes, and you can choose the one that best aligns with your interest or your role. You'll see a list of rooms appear. Simply click join to enter the chosen room. We will post instructions in the chat for how to do that. Please note, breakout room conversations won't be recorded. The first breakout room, research and measurement. The second, education and learning environments. And the third, practice and innovation. We'll last 20 minutes of discussion, come back about 10 to the hour. Your facilitators will guide the conversation, and we encourage you to share your experiences, questions, and ideas. We'll reconvene as a full group at the end and share key takeaways from each room. If you have any trouble joining, just stay in the main room and we will help get you sorted.
Hey, I think we have everyone back with us now. Recognizing it's a few minutes before 1 o'clock, we have 1 or 2 minutes for each group to share back. And then we'll do our 1 o'clock transition, just recognizing a few folks may have to leave at the hour, and then welcome anyone who wishes to continue the conversation to stay with us afterwards. So briefly, we'll start maybe with Ben from the Research and Measurement Group, and then move to Jessica from Education and Learning, and then I will share back from our Practice and Innovation Group. Over to you, Ben.
Okay, thank you. I appreciate the conversation very much. Folks in the room, please jump in to add points as I go here. We talked a bit at the start, burden of measurement with the team, and that it's just another thing for to people to have to collect data on or what have you. But so the importance of communication and engagement, that this is something to be used for change, that it is something to have impact, and to really try to create that feedback loop with people about that, and balance the rigor of meaningful data collection with that burden of the work of it. The metrics in the process, I think people were looking for more of the balancing or more informative, concrete kind of measures beyond just that emotional state measurement, especially because for a lot of projects, the feasible timeline tends to be kind of short, a few months maybe, and that to see a distinct change within that time frame might be unrealistic or really challenging, and that a longer term kind of process to this might be really important. And for some people, just seeing the data, seeing themselves reflected in it can be really uplifting and affirming, but sometimes more concrete measurement might actually have more impact as well. So what steps were taken, what changes happened, things like that. One of the folks talked about a system that their workplace uses to do a similar thing of measuring emotional state among the team. But it's a costly system to license. It's quite in depth, and just comments that this system here today seems like a more moderate version of that can potentially be really useful the way that other system was found to be useful. And having visibility is important. People being able to show that emotional state kind of information to their colleagues in real time can be really useful. Just like, like we talked about a pin that's red or green, depending on the day and the situation. But that also that vulnerability can be a real factor, and people, resisting or not really cooperating, following the process because of vulnerability. And so the engagement, the psychological safety, and that these are all really critical things for this to get very far. And sometimes that means trying to, enable the team to keep the data just to themselves until they reach a point where they want to share it more broadly. And particularly to try to reinforce this isn't information about how well they're doing in their job, but rather this is something about their well-being and how to actually try to make gains on that as a group. So yeah, some really great points there, I think. So maybe I'll pass it over to my other facilitators here, Jessica and Marianne.
So I'm going to speak for the group very quickly because I need to go. So we were talking about what makes joy in the workplace and education and things like that. So talking a lot about how psychological safety, professional development, and curiosity are at the center of that. And the process should be supported by leaders. So having that leadership or executive sponsorship is helpful when you've got leaders that have the model fallibility. So walking the walk, talking the talk, it's easier for folks to follow along. And if you see actions coming out of the leads and things like that, others are more inclined to bring things forward that are barriers or that are discomforts. I thought this was a really great one from Chris. Language has an important impact, so sometimes using labels creates barriers in unintended ways. There was a suggestion to change the language around unaware and allow teams to have their own autonomy to choose what label they would like within that pillar. Team culture is certainly an underlier, um, and real bonds can be formed when the team hits lows as it rears strengths and resiliencies rather than being viewed as a negative thing. Um, and then how do we move clinics towards this? So again, we talked a little bit about the good day, bad day, which is a relatively easy exercise to tackle. We also talked about a simpler form of that if you're encountering a team that's quite overextended. Jessica suggested the marble technique, which I think I'm going to use with a couple of teams. I really liked that. And then we talked a little bit about how do we assess um, psychological safety before proceeding to implement a pathway towards joy in the workplace. And talked a little bit about how our team uses anonymous assessments because we know that oftentimes the problems that come to us are around communication and conflict. But if we see that there isn't psychological safety, nothing else works, right? So using that as a pillar to move things forward to joy in the workplace. Um, and then just the only last comment that I had was there was a consideration for the pillar labels to be moved to fragmented, reaching, connected, and integrating, which is good. And I will see everybody later. Take care. See you
Thank
tomorrow,
you,
Ben.
Joanne.
Thanks,
Okay,
Joanne.
bye.
Thanks so much.
You're welcome.
And I will quickly share from the Practice and Innovation Group. We had a great conversation. Folks in the group shared that their experience is joy shows up where there's vulnerability, an environment of trust, and a supportive culture, which led us into talking a little bit about leadership and leading towards joy. And identifying that leaders build cohesive, inclusive teams and themselves need to mirror the values of the organization and the team. And talked a little bit about how do we mirror those values. One of our members shared doing some work with self-determination theory. And from the lens of well-being, that tells us that all humans have evolved to need to feel autonomous, competent, and related to others or in relationship with others. And the leaders have a role in enabling this and showing vulnerability, ability to be trusted themselves. It was expressed that teams that were good had opportunities to connect, food days, lunch and learns. They received recognition for their work and regular meetings with knowledge sharing. And one person in the group shared that they develop guidelines and team agreements for wellness. So, amongst the team, a commitment to making sure people take their lunches or take their breaks, and ending meetings 5 minutes early so that folks get time for a bio break between virtual meetings, for example. And the last piece that came up was the conversation about virtual or distributed teams versus in-person teams. And it's harder to feel connected on virtual and distributed teams. And one of the folks in our group noticed that because they're primarily in a virtual team, when they had the opportunity to come together in person, that helped create or solidify some connection amongst team members. So what was really important was that opportunity to connect, particularly amongst the virtual teams with some in-person connection. Marianne, would you add anything else from our group? Oh, I remember the last thing you said was this work, it's best coming from the front lines, that it's ideally generated from the ground up. And start small, that it can be something as simple as a 5-minute huddle in the morning, connection with a few folks in the team, and that it spreads from there. Okay, I recognize it's a couple minutes after 1, and I know we've lost a few folks and a few more may need to go just because it's 1 o'clock. And so I want to thank folks for joining us. We will be continuing the conversation, but from here, just a brief transition right now. Thank you for joining us today. And a reminder, if you can, to please take a moment to look at the word cloud and add a word in it. Um, we've got a few words in there. I'm gonna be hopeful that we'll get a few more towards the end, and then share it at the end. But we're seeing authentic conversation. Are you sharing it for us, Ben?
Yeah, this is the Slido QR code and access code.
Perfect, thank you. We're seeing excellent, meaningful joy research, meaningful measurement as important. We need protected time and space to foster well-being, and again, an uplifting of the importance of joy in the workplace, starting to show up in the word cloud. So I'll open the floor to group discussion and invite Ben and Marianne and Jessica to join in guiding this part of the conversation. And Chen, maybe if we can bring everybody on screen so that we can all see one another. Thank you. And Ben, do you want to start us off with a question or a prompt or?
Yeah, I have the feeling, I know our group was talking right up until the moment when the Zoom room comes back to the main, and sometimes people get sort of halfway through their thought. And so I think it's really great to have this opportunity to continue as that, people were in full swing in the conversation. Um, but yeah, I'm wondering, one of the things we were talking about, it seems like that engagement is as a crucial through line, and I think it's really addressed in the material about how the role of leadership and the importance of the team's not just participation or buy-in, but to actually to invest in the process. And the more that it can be that kind of empowered, like the team don't feel it as an imposition, but rather as a good opportunity and a good worthwhile use of their time and effort. I think that's the magic that you're kind of pursuing with this. Um, and I'm curious if we've talked a lot about that in the report back. I wonder if there are further thoughts about that.
One of the things I didn't explicitly name in the report back for our group was the value of informal conversation in the connections. And so the knowledge, so someone said knowledge, don't look at knowledge as power, but as sharing. And in that, valuing what we each bring in, and the ability in those 5-minute huddles to not have an agenda, top down, agenda driven huddle, but to say, what's happening for you right now? What's most important? What do you need? What do you see? What do you think? And allowing space for that. I think of it as generative conversation.
Yeah, thanks for that, Lee. We get so focused on asking our patients, our clients, our individuals, like what matters to them, but often we're not asking sometimes the question of what matters to our people, our teams, our people that we work with alongside. And that question, when asked, in our experience, is sometimes people are surprised first that they're being asked that. And then often once they get over that surprise, it's like it's a bit of a release, and then it comes. So I think it's a really powerful question that I hope that we can keep asking.
Jessica, you mentioned that was kind of step one in processes with teams. Was that always the case? And I'm curious about how this process kind of gets at the early days of it, how it's received, and the how those interactions go at the outset. Um,
I'll jump in there. I think languaging is super important. So often terms like joy in work, if you're disengaged and morally injured and those kind of words, especially if you're cynical like me. When I heard about the course when we were starting this, it was like, oh, for God's sakes, what are they going to talk about there? So, kind of reading your room and how are you going to frame this and what do you want to talk about? But the other thing is what we noticed, I think, in every group is when you start having these conversations, and the white paper also refers to this, is people initially are like, oh, nobody's ever asked me that before. And then once they get started, you get all their crap. So I can't take holidays when I want, and you get dumped on. And so I think you have to have that expectation that that's what you're there for. And you're, thanks, great, thanks, keep it coming. And once people trust that they're okay talking to you about what's most important to them, then you can kind of get past some of that stuff. And well, how could we work together to work on some of these things?
Is there kind of a thing, is overwhelm in that process a challenge for the leaders to open that? You talked a bit about like a floodgate kind of situation. Is that, have you kind of noticed that experience?
Yeah, I think it is. I think when we've done courses where for leaders in interior health, that's often well, I don't know if I want to go there. And what do I say if they want to know this? And I know the health authority doesn't support that, or so it's a little bit thinking ahead, and it's also just kind of feeling comfortable with things that it's okay to say, oh, I don't know the answer to that. So again, back to the vulnerability of, well, I'll go find out, or I can take that away. And so I think it's making conversation safe and yeah, often in healthcare you don't get good responses to comments or questions or criticisms. So yeah, it's sorting through that whole piece.
And I think to add to, I think that's where kind of leadership setting the tone really makes a big difference. So I can use an example. Our executive director at Kelowna General Hospital a couple of years ago, they actually utilized Good Day, Bad Day with their manager team. So it's a large manager and director group. And they originally thought that they might go first approach this on a unit level, but realized actually they as a group, as a leadership group, needed to have these conversations about what made their day good and what makes their day not so good as their leadership team first to start. And then from there they uncovered, so they actually did it electronically. So another way you can do good day, bad day, because it's difficult for them to use a chit or, a marble. So they converted it into a quick electronic tool at the end of the day. They just sent it off. They collected that data, I think, over a few weeks, and lots came out. And it was their executive director who kind of led that, heard that feedback, and then actually started embedding that feedback into their work plan over the next year. And then that meant that the managers and directors then could, move towards working with their teams in that, because they saw that kind of leader-driven effort at that level.
Incredible. Marianne?
I just want to address the comment in the chat about patients and families. If you know that you're doing an amazing job with your team, if they're comfortable, your whole team is good with bringing patient partners and families into the group, which is the ideal of quality improvement, because the patient and family should be at the center of everything that you do, whether you're corporate teams or clinical teams. So ideally, you have patients and families involved, but that's really tough for all of us to do. And we often feel like our teams are in no way, shape, or form ready for that kind of thing. So I think resilient teams are great at that. And that's kind of a goal. And I would say for our matrix, we had patient partners help us with the languaging for what does patient feel.
Marianne, do you still have a new hand up or legacy hand there? Okay. We talked a bit about the length of time that is involved in this, the time frame. If you're working with a couple of months, that's a real uphill situation. if you've got a longer term time frame and you've got the ability to stick to it, your prospects might be a whole lot better. Do you have any thoughts on that, or advice, or just affirmation, or what have you?
I think just the recognition that it is challenging, is a challenging environment, and it's very fluid. Our teams are shifting and changing from one day to the next, but I think you gotta just go for it. You don't need to boil the ocean, but you can start with something and start with engagement, and start by having those conversations. Find your super connectors. If you are starting to collect data, make it a SMART goal, make it very achievable, and get data in front of the teams as quickly as you can. And if you ask the question what matters to them, and you get something that's very tangible, you act on it as quickly as you can. So you really look at what's within your span of control as a leader, and you pick and you choose those pieces, and then you consider what is outside of your span of control, and then you start bringing those boulders up to more senior leadership, and then you loop back to and tell your teams that you're hearing them, you've brought this forward, and this is where we're at. So that, I know it's super challenging in this environment, but yeah, I would suggest you just got to start by doing.
I imagine that span of control aspect is something really significant. Yeah, I mean, you mentioned it a few times.
Yeah.
I think that, and that's part of the maybe fear is the right word about the overwhelm, the floodgates. And I'm interested in hearing you say, that when asking that question to be very explicit about span of control, like this is within, this is outside, and to try to talk explicitly in those terms, in order to try to manage that dynamic and get somewhere with it.
Mhm.
Yeah, the Joy and Work white paper talks about pebbles and boulders. So pebbles are things you can move together. Which pebbles should we work on? And the boulders are the things that you got to heave up to the next level. And we'll try and work. What can we do? That boulder's in our way, but what can we do with the pebbles? And the other thing I would just highlight to everybody is have somebody that you can share stuff with when this work gets hard, which it does if you're hearing some tough stuff from folks, is have your buddy that thinks in the same way. So Jess and I have been doing this work for lots of years, and we keep connecting, and we don't even we haven't worked in the same area for 8 years now, but we still continue pushing the work forward and coming back and troubleshooting for each other. So it really helps to have somebody who believes in what you're doing as well, that you can go, okay, yeah, this is worth doing. And because it's totally worthwhile, it's just can be challenging.
Yeah, that's why we just spoke about like informal networks are incredibly important. I mean, we often have people reaching out, just just wanting for advice or just having a chat and just kind of walking through what they're doing with their teams and bouncing ideas off of us, um, and kind of problem solving together. And the other thing we kind of just referenced was a community of practice. Like this would be, for us, would be great to have a more formal community of practice where we could come together and share, um, different what people are doing around team well-being. Just like we said, are they using the matrix, and kind of have that formalized structure. It is what iHigh has recommends and often uses for more formal quality improvement networks.
Okay. I think that we've covered a whole lot of ground today, and I am tremendously appreciative of learning about what you've experienced, put together, and just the huge wealth of knowledge and experience that's gone into this. So a huge thank you, Jessica, Marianne, and to everyone who's participated today. Thanks for joining us. And is there any sort of last comments as we close it up here? Okay.
Thank you for the conversations and coming away with some good tips. So I was happy to sit here and listen. So thank you.
Fantastic. All right. Well, I look forward to seeing some of you next time And take care. And thanks again for joining today.